Hi, Stephen. I'll be one moment. Hi, good to see you.
Hi.
I'm glad you came in. So I understand you're here to talk about getting a new prescription for the oxycodone. So is there anything else you were hoping to discuss today?
The pain in my ribs is still too much for me. Every time every time I take a deep breath or even just bend down to, feed my dog or something, it's miserable.
Sounds like you've been in a lot of pain, and it's made it pretty difficult to do some of the things you normally do. So tell me a little bit about your routine and what your pain is like.
Well, I used to be able to go outside and jog around. I play some sports with my friends every so often, but I can't do anything now besides just lay in my bed.
Sounds like you were really active before, and this pain is really causing a lot of problems for you. If you would rate your pain on a scale of 1 to 10, where would you say your level is?
On average, an 8 usually, sometimes less, sometimes more.
Okay, so pretty high levels of pain.
Yeah, and nothing makes it better except when I take oxy and smoke some weed.
What kinds of things have you been doing to manage your pain?
Um, just taking the oxy you prescribed and smoking some weed, every now and then again to just ease the pain.
Okay, so you're taking the oxy, you're smoking some weed. Can you tell me a little bit how you've been taking your medications and how often you're smoking?
I mean, I'm taking the oxy just as you prescribed, one every 4 hours, just as the bottle says. Um, Smoke weed maybe 3 or 4 times a day just to take the edge off.
What other kinds of things have you been trying to manage your pain right now?
There was the hot and cold treatment, but that just felt like a waste of time, and so did the topical cream. It's just a waste of money.
Okay, so the hot and cold didn't seem to work, the topical cream didn't seem to work, and it sounds like you've been taking the oxy and smoking some weed, and that's been a little bit helpful. Tell me what else you've tried for your pain.
Uh, Nothing else besides that, really. Like I said, the oxy and the weed. It was hard for me to even to walk here.
Now, I'm curious, if you had a magic wand and you were able to wake up tomorrow and your life was different, what would it look like?
I'd be outside again, uh, playing sports with my friends, just enjoying life, getting back to the things that I just haven't been able to do.
Stephen, I think those are really great goals, and I think those are things we need to be working towards. And as your doctor, I also need to share with you that I'm concerned that you're still on the oxycodone 6 months out from your injury.
6 months really isn't that long. I'm still in pain. And I mean, if I wasn't in pain, I wouldn't be taking it. It's your prescription. I don't know what else to do. I need relief.
Well, I'm not trying to push you, but I do think it's important for us to think about pain management that is not going to cause you more problems and is going to allow you to get you back to the lifestyle that you really want to be living. What kinds of things do you think would be helpful?
I really don't know. I'm out of ideas.
Okay.
It's not my fault I'm in this much pain. You should have known if I was going to get addicted. Why didn't you tell me?
Well, and I'm sorry, Stephen, I don't mean to be pushing you, but I do want to talk about maybe what the next steps would be to be helpful for you.
Well, I mean, if you have any recommendations, I'd be willing to hear.
I think it's really important that we choose a plan that you feel like you're able to do, that works with you, and you feel capable of following through with. Now, thinking about what you've done already, what do you feel like would be helpful at this point?
Really anything that keeps me out of the pain. I mean, would you have any recommendations? I'd be glad to hear them.
Great, I do. I'd actually love to share some information with you from the Center for Disease Control. They have some guidelines about how we approach pain management in situations like this. Would it be okay if I talk with you about that?
Yeah, I guess.
Okay. So what the guidelines do say is that for people who have had injuries like yours, that we want to be using prescription pain medications in a certain period of time where it's effective, and that tends to be 6 weeks. So we're beyond that at this point. Now, from that point, what we like to do is transition you to over-the-counter medications. So taper off the oxy and go to things like Tylenol, Aleve, and Motrin, and do that in combination with some holistic therapies like we've talked about before. You know, when people are on the oxy for longer than 6 months, we put you at risk for some opiate dependence and some other health concerns. So I think that what would make sense at this point is to think about transitioning you off of the oxy onto one of these over-the-counter medications and using some of these other techniques to help you manage the pain. What do you think about those guidelines and maybe that plan?
I could agree with them. It's just those holistic therapies you talked about require a lot of movement. And without that pain relief, I don't know how I would get through it.
Yeah, I hear that. It's scary to maybe do anything that might increase your pain. That makes a lot of sense. And I'm not opposed to prescribing you some other medications for pain. But as your medical provider, I also have to say that I don't think smoking marijuana is the best means to manage your pain right now. And I'm wondering what you think about making some of these changes.
Yeah, I'd be willing to try anything to get rid of this pain, and if you really think that's the best option, then I will listen to you.
I do, and I think we need to think about what you're willing to do, what you're able to do, and what you feel like you can do most consistently. So it sounds like at this point we're thinking about tapering off the oxy, getting you onto something like Tylenol, and doing some exercise that you feel like you can do. How do you feel about this plan?
I'd be willing to try the holistic exercises you were talking about, and taking Tylenol. But if I'm in pain, then I'm going to call you.
Absolutely, and I want you to call me. And I think it actually makes sense for us to set a time within the next week for us to talk, maybe do a phone check-in and see how you're doing, and even if you're not doing any better. And then we can take it from there and see what changes we need to make to the plan.
All right.
Great. Well, I have to say I'm really glad that you came in, and I think it's very courageous to take the step and facing some of this pain as well to get you back to the life that you really want to be living right now.
Awesome.
So I thank you for coming in, and I'll talk with you next week.
Thank you.